Good morning, and thanks for attending. Today I'm joined by Andrea McLellan, Director of COVID-19 Immunization Strategy, who will speak about the vaccine rollout, and Shannon Mantha, Executive Director of Clinical Services and Chief Nursing Officer, and she will provide an update on the local COVID-19 situation. Over the last few days, we've seen some daily provincial numbers of COVID-19 close to 3,500. Although the daily decrease is a good sign, it is too early to determine if our provincial numbers are plateauing. Our critical care units continue to experience growing pressures, resulting in patient transfers throughout the province. Patients are younger, they're more ill, they're requiring mechanical ventilation, and remaining in hospital longer. Our district has had the lowest case rate in the province over the last 7-day period, April 17th to 23rd, as well as the lowest cumulative case rate over the course of the entire pandemic. However, we must keep in mind that there is community spread. People get the virus and don't know where they got it. So there are more cases in the community that we don't know about, so they aren't reflected in our numbers. It is exciting that we continue to keep our case numbers low, but as we know, the situation can change quickly, and we all need to remember to remain vigilant in following public health measures. Until we're able to get everyone vaccinated, this is our only way to slow the spread of the virus. I know the shutdown and additional restrictions are difficult for all of us, for our financial well-being, our social health, and our mental health. Small businesses have been particularly impacted by the uncertainty and the ever-changing restrictions from week to week. This is why we've said the quickest path for a lasting reopening is not reopening too soon. It is our belief that we need to get the provincial numbers under control, and we all have a role to play in that. We're not an island, as we've said many times. Locally, we are not seeing the same increases as the province has. This is thanks to the hard work and sacrifices you've all made. Lastly, it is important to be COVID kind with one another and not use hurtful language that discriminates against people. With that, I'd like to now hand it over to Ms. Mantha to provide an update on our local COVID-19 situation.
Thank you, Dr. Chirico. In the last 7 days, we've had 16 new cases, bringing our total case count to 351 cases, with 230 of those being in the Nipissing district and 121 in our district of Parry Sound. As of this morning, we have 16 active cases with 2 cases hospitalized. There are 4 active variant of concern cases in the district. As Dr. Chirico mentioned in his opening remarks, a quarter of our recent cases have come from community spread. This means that we are unable to determine how or where they acquired the virus. Additionally, in the past 14 days, more than 1/4 of our cases have been among those aged 19 or younger. So while we're very fortunate to have low case rates within our district, the changing trends in our cases and the evolving provincial situation serve as a real reminder that we need to stay the course with public health measures and keep our cases and community transmission rates as low as possible, as well as get a vaccine when one is available to you. Switching topics a little bit, in addition to the work that we do in case and contact management and vaccine rollout, the health unit plays a role in monitoring local businesses for compliance with provincial regulations, as well as responding to complaints from the public. We are very pleased that the majority of businesses in our communities are following public health measures and regulations in an effort to prevent and help reduce the spread of COVID-19. While there have been complaints and confirmed non-compliance, or where there have been complaints and confirmed non-compliance, our public health inspectors have acted accordingly using a progressive enforcement approach, such as in the case of Stewart's Decorating in North Bay, where a closure order was recently issued following continued non-compliance. The significant impact of COVID-19 the significant impact that COVID-19 has had on local businesses is definitely not lost on us. And we're very thankful that the vast majority of businesses in our district are going above and beyond to help protect the health of community members. With that, I'll pass it back to Dr. Chirico.
Thanks, Ms. Mantha. And it really has been incredible to see the great work of our business communities. And we want to thank you all for your sacrifices and for following COVID-19 regulations. So Ms. McLellan, can you please provide an update on our vaccine rollout this week?
Thanks, Dr. Chirico. Good morning, everyone. As of this morning, we are very excited to share that we have provided 40,723 vaccinations across our district. 38.1% of those 18 years of age and older who are residents of our district have received at least one dose of the COVID-19 vaccine. We continue to plan our immunization strategy to meet the needs of the various eligible populations within our district. A one-size-fits-all approach will not work for everyone. Last Thursday, a COVID-19 vaccination clinic was held at the Low Barrier Shelter in North Bay, where 54 individuals who are part of the priority population received their first dose of vaccine. The clinic was a collaborative effort between a number of community partners with the goal of meeting the unique needs of this specific population. Planning is currently underway to offer more of these specialized vaccination clinics across our district. Last week, the province added pregnancy to the highest risk health conditions list. On Tuesday, we opened up eligibility to childcare workers in licensed childcare facilities and individuals with high-risk health conditions and their essential caregiver. This morning, we opened up eligibility for those 55 years of age and older to book appointments to receive their vaccine. In an effort to accommodate these groups, we are able to identify appointment openings in North Bay and the Parry Sound. We were able to identify appointment openings in the North Bay and Parry Sound areas. We still have some spaces available in the North Bay Clinic tomorrow. So if you're part of any of the eligibility groups to date and wish to have an appointment, please feel free to call the health unit, or if you're able to, go online to book your appointment at ontario.ca/book vaccine. The health unit's call center is open to anyone who requires assistance booking an appointment. The call center will be open on Saturday from 10 a.m. to 3 p.m. to support those who require assistance with booking their appointment. All our clinics across the district have been an overwhelming success thanks to the hard work and collaborative efforts of the municipalities, our community partners, and the staff and volunteers who are working at our clinics. Their support and commitment is key to our success. Our vaccine rollout truly is a community effort. And with that, I'll hand things back over to Dr. Chirico.
Well, thanks, Ms. McLellan. And that's it for our prepared remarks. Now, if we'd like to begin answering your questions, if you have questions, please type them into the Q&A at the top of your screen. Our moderator will read them aloud, and we will try to cover as many off as we can. And when possible, please ensure that your name is attached to the question.
Our first question comes from Clark from Your TV Cogeco News, and it's directed towards Dr. Chirico. Dr. Chirico, are you able to shed some light on the Stewart's decorating situation?
What I can say is that we have really experienced a great compliance and collaboration with our business community from the onset of the pandemic. We provided education, answered questions, helped them prepare for any of the issues that they were having related to infection prevention and control. And part of our mandate also, as Ms. Mantha has mentioned, is that we have a mandate to enforce. And the way we do it is, as was stated, through progressive enforcement. We always work with the clients, we speak to them, educate them. We then, if we still don't get the response that we need to have, then we give warnings, and when that fails and all reasonable precautions are not being taken, then we have to act. And when we acted, we issued fines, and when there was still non-compliance, we had to issue orders, and it's before the courts now.
Our next question is directed towards Andrea. It's Jennifer from The Nugget. Have we seen a decrease in vaccine allocation, or have we been guaranteed to receive the same amount?
Thanks, Jennifer. That's a great question. No, we have not seen a recent decrease in our vaccine. We've been, our number has held steady. We are hoping with the arrival of more Pfizer vaccine over the course of the next month or so that we will start to see a little bit of an increase in what we are receiving, but we have been told we will not see a decrease in the vaccine amount that we have.
Thank you. Our next question is for Dr. Chirico. It comes from Eric from CTV News. The owner of Stewart's Decorating has gone on record saying she vows to fight to close despite the health unit's order. What further penalties are the health unit exploring? What exactly was Stewart's Decorating doing that was non-compliant?
So through the Health Protection and Promotion Act, there are significant fines, and it will be up to the court to decide. And with regards to the charges laid against her, because it's before the courts, I'm not going to go into the details, but other than to say that we worked with the owner of Stewart's Decorating in an effort to get compliance, but we weren't able to do that. Clearly, under the stay-at-home orders that were issued and the non-compliance, we were forced in a situation that we had to issue the orders.
Thank you. Our next question is from Sarah Bissonnette from the Parry Sound North Star, and it's directed to yourself, Dr. Chirico. Regarding business enforcement, does the health unit respond to complaints, or does it actively go out to ensure compliance?
We do a little bit of both, actually, and we follow up with complaints. And as I say, the initial step is to go to talk to the owner. And some businesses simply say that, and may not have known what the issue was and correct it right away. And that's all we want to do. So in those situations where they work with us and are compliant and put things in place, then no further action is required. And we do follow up to see that what we have asked them to do is being done. Similarly, we do spot checks in businesses as well to ensure that there is compliance. And everybody is under the same law and are expected to follow them. And I want to say that the vast majority of businesses, they're very concerned about their customers, and they want to do the right thing. They want to keep them safe, and so they do follow all the recommendations and the public health measures because it benefits all of us in the community. And the more we can keep it out of the community and keep our numbers low, it benefits everybody, and it also helps us with not having outbreaks in businesses, not having outbreaks in schools, because our community transmission remains low. And that's everybody's responsibility.
Thank you. Our next question is for Andrea. It comes from Jennifer from the Nugget. When there is space available for a vaccine appointment, is there any opportunity to open it up to the general public as to not waste any vaccine?
Hi, Jennifer. Thanks for that question. We don't waste any vaccine, even if we have openings within our clinics. The amount of vaccine that's taken to a clinic is based on the number of appointments that are in the system. And so we wouldn't have any vaccine wastage as a result of not having appointments filled. And we need to stick to the guidelines that the ministry has put out with respect to the phased rollout and follow the directions that we have for who's eligible to receive vaccine.
Thank you. Our next question is for Shannon. It comes from Sarah Bissonnette from the Parry Sound North Star. With schools closed, how is the health unit and partners helping with children's mental health?
So thanks for that question, Sarah. We're very concerned about the impact of school closures and really the pandemic in general on the health and well-being of children and youth in the district. We've said this before, you know, schools are an important contributor to students' overall well-being. And we know that there's a lot of students in our district that face significant barriers to the remote learning environments that they're in right now. And these barriers often extend beyond just access to internet and access to technology. We do work very closely on a regular basis with our local school boards, as well as the lead agency for child and youth mental health across our district of Nipissing and Parry Sound, HANDS, the Family Health Network. And as partners, we're engaged in actively discussing the state of mental health and well-being of children and youth, and working to provide resources and services quickly and put things in place for families. So I think I'll close up by saying, if you're a parent or a caregiver and you're concerned about the well-being of your child, please, you know, reach out and access community resources. You can visit our website at myhealthunit.ca, or you can visit the HANDS, the Family Health Network website. And there's a variety of resources you can access immediately, as well as services that you can call to access as well.
Thank you. Our next question is for Andrea. It comes from Sarah Bissonette from the Parry Sound North Star. To determine the percentage of adults vaccinated, does the health unit use local doses administered, which can include those who live outside this area, or provincial numbers, since some local residents leave the area to get an appointment?
Thanks for that question, Sarah. The percentages are based on our local residents' immunization status, whether they've received their immunization within our district or outside of our district. That information is able to be pulled from the provincial database, and that's where that percentage comes from.
Thank you. Our next question is for Dr. Chirico. It comes from Tom from Radio Works Parry Sound. What is the current status of elected surgeries at hospitals in the district?
What we do know is that there has been a provincial directive that non-urgent and non-emergent surgery it has been curtailed. But with respect to the specific hospitals within our district, I'd refer you to connect with them directly for their current status.
Thank you. Our next question is also for Dr. Chirico. It comes from Jennifer from the Nugget. Has the health unit been contacted by parents of school-aged children or golfers or local businesses to advocate on their behalf to get golf courses open or open schools?
There's always the, certainly we have had concerns about schools, and yes, we've had people advocate to have schools reopened, and we've also heard the cries from the golfers, myself being one of them, but we have to all follow the provincial directions right now, and that's a decision for the province to be made on both of those topics.
Thank you. Our next question is for Andrea. It comes from Clark from Your TV, Cogeco. With the North Bay Regional Hospital receiving COVID-19 patients from out of town, will nurses and doctors at the hospital receive their second dose of the vaccine? Do these new cases register as local cases?
With respect to the second dose vaccine for healthcare providers, the direction from the ministry is a 16-week interval between first and second dose, and that is the interval that continues to be what we will be providing. With respect to the cases, I'm going to pass that one to Shannon, that part of the question to Shannon.
So sorry about that. I had trouble getting off mute. So in terms of the cases, no, those cases won't be included in our local case count that you see on our website or within our dashboard. So because they reside out of district, they don't meet the criteria for being included in our case counts.
Thank you. Our next question is for Dr. Chirico. With the confirmed presence of a COVID-19 variant originating in India in Ontario, is the health unit still identifying the exact strain of variants of concern when a preliminary result is determined?
Yes, they are looking into it. It takes, first of all, they are testing it to see if it is a variant of concern. Currently, the variant that is originating from India is a variant of interest, which is a bit different, but they are checking to keep a very close eye on the number that are present. What we do know too is that the variants of concern predominate. They are significant in Ontario. They've really taken over from the original COVID-19 strain, and over 90% of them would be found to be variants. We also know that the most predominant variant of concern among the ones that we have is the UK variant, and it is extremely high, over 98% or thereabouts. So they are checking for that variant, and there is surveillance that is ongoing in many countries to look for new variants that may arise as well.
Thank you. Next question is for Andrea. It comes from Eric from CTV. For the vaccine clinic at the Low Barrier Shelter, 54 people were vaccinated. Were they staff members or clients or both? If they were not clients, when can clients receive their first dose?
Thanks, Eric. That's a great question. The 54 individuals reflects the clients, not the staff. There were some staff who were also immunized, but the 54 the 54 is representative of the clients.
Thank you. Our next question is for Dr. Chirico. It comes from Stu from Bay Today. Dr. Chirico, of the factors outside your control, which one worries you the most? High case counts in neighboring health unit districts, or low supply of vaccine?
I'm sorry, I didn't hear the last part. Or low
supply of vaccine.
I would say at this point, the biggest concern and where we need to focus is keeping case numbers low. Vaccinations, it is not going to provide the immediate solution to slowing the spread of this virus in the short term. In the long term, yes, absolutely. And we expect that we will get more vaccines and get people vaccinated. But currently, the way that we're going to win this battle and slow the spread, flatten the curve, and prevent our healthcare system from being overrun is for people to be following the public health measures. Everybody knows what to do. We've been at this long enough, and people know that they have to use good judgment, and they simply have to stay away from other people and go out only for essential reasons. So we do have that control, and so that's what worries me the most, is the potential for the healthcare system to come overrun, and it can happen up here as well. Even though we have very low case numbers, it can change very, very quickly. So that would be my biggest fear.
Thank you. Our next question is for Andrea. It comes from Jennifer from The Nugget. According to the Board of Health meeting last night, I heard that 40% of adults over the age of 18 in Mattawa have received 1 dose. Are there any other communities with similar high numbers?
Hi, Jennifer. Thanks for that question. I will have to get back to you with that information. I don't have it readily available. I can tell you that 38.1% across our district have been immunized, but I can't give you the breakdown specifically right now across the district, so we'll get that information to you.
Thank you. Our next question is for Dr. Chirico. It comes from Sarah Beesnet from the Parry Sound North Star, and it's a follow-up question. So are there any businesses in the Parry Sound district that have been brought to the attention of the health unit for non-compliance?
I would have to get back to you on that one. I don't believe that any charges have been laid, but I'd have to check to see if there have been discussions we follow up on all complaints, but I don't have that information readily available. But we'll get back to you on that and let you know. And if there have been any charges that have been laid, we will certainly identify it, but I don't believe that there has.
Thank you. Dr. Chirico, this question is also for you. It comes from Jennifer from the Nugget. Do you have any idea after the lockdown on May 19th whether health units will go back to the color framework? And if so, what color do you suggest we are in?
That's a very good question, Jennifer. Thank you for raising that. Again, we don't have that information. It is a little bit premature. We haven't even had those discussions provincially. And I think it's really important that we learn from our past experience, and we have to ask ourselves, and the province has to ask themselves, how effective was it? Is it helpful to have zones that are differing in their restrictions? My personal feeling is that no, it doesn't help, because human nature, being human nature, what we experienced in the past is that when you have areas of high restrictions near areas with low restrictions, people travel, and that's how the virus spreads. So we have to critically look at it, look at the evidence and the science, and make the best decision on that information. So that's what we are recommending happens before any decisions are made.
Thank you. Next question is for Andrea. It's from Jennifer from the Nugget. If we stay on the current path pertaining to vaccinations, when can the North Bay Parry Sound District Health Unit expect to reach herd immunity?
Hi, Jennifer. That's a great question. But at this point in time, I really don't have the ability to predict that, because it hasn't been determined what the percentage of the population requiring immunization for COVID-19 is required to achieve herd immunity. Generally speaking, with vaccines, it's somewhere between 75 and 85%, but I don't believe it's been specifically determined for the COVID vaccine. Perhaps Dr. Chirico has something he could add?
Andrea, you're absolutely right. There are so many factors involved in determining herd immunity, and we aren't even close right now to having that information to actually do that. We're trying to get as many people as possible, but more studies will have to be done. We have to look at really not just how many people have been vaccinated, but how effective it is, how long the immunity is lasting. We have to also determine what the prevalence is, meaning the number of cases within the community that we don't know about, that people were infected with the virus, developed immunity to it, but never showed any symptoms, or very mild, were never tested. So all those factors will play into the whole herd immunity scenario.
Thank you. Our next question is for Dr. Chirico, and it's from Eric from CTV. The health unit district has the lowest case rate in Ontario over the last 7-day period. What do you believe is the biggest contributor to this statistic? Vaccine rollout, low case count, or both?
Definitely not the vaccines. I think that certainly it's too premature. There are not enough people vaccinated to have that account for the low numbers. I believe the low numbers and the low numbers throughout the entire pandemic has really been a combination of a number of factors. I think that the people within our communities have really worked hard and sacrificed and knew what the measures were and followed them for the most part. I think that really significantly contributed to it. I think there are other factors too that came into play. We have to look at our demographics, meaning the makeup of our communities. There's a lot of rural communities. We have open spaces. We don't have the population density. We have an elderly age group as well, which would, enhance certainly compliance, may change travel patterns as well. I think we also have to look at the makeup of our workforce and the sectors that we have. others may be more prone to it, like very large warehouses where multiple people may work, mining industry, lumber, all of those type, whereas our sectors are more healthcare based, they're more education, government, and so all of those factors I think contribute to it. But I can't underestimate the sacrifices that people have made, and I think ultimately it comes down to what individuals do that really make the difference. So thanks, that's a great question, and thank you for that.
Thank you. Our next question is for Andrea. It comes from Jennifer from the Nugget. How long will the health unit keep the mass vaccination center open at Memorial Gardens?
Great question, Jennifer. At this point in time, we know that we will be there till at least the end of July. There will be a lot of factors that determine our ability to continue to remain at the Memorial Gardens, where we are overall in the province with COVID, things like that. Memorial Gardens is certainly used for a number of different activities, including hockey and at the OHL level, and as well at the local level and the university varsity level. So at this point in time, I can safely say till the end of July, and we are definitely going to be looking to confirm that we can continue to remain there and or come up with a plan for where we would move to if there is a need for us to move.
I'd also just like to add to that you know, not just within North Bay, but throughout the entire district, all of the municipalities have been so cooperative, collaborative, helpful. We could not do this without all of those organizations and cities, municipalities that have come together and help facilitate these clinics that have run so extremely well. And so a great shout out to that effort from everybody.
Thank you. So we have no other questions in the queue, so that will conclude our press conference for today. The recording will be available on our website, and we will see you next week at the same time. Thank you.